Welcome back to the American College Surgeons Bulletin Brief from the front line, Surgeons' Voices. With me today, I have the pleasure of bringing back to our program Dr. Danielle Walsh. Dr. Walsh is the chair of the Board of Governors. Dr. Walsh also has experience in both private practice, which she currently is in private practice, and formerly academic practice at East Carolina University as a pediatric surgeon. Welcome, Dr. Walsh.
Thank you. It's a pleasure to be here today, Dr. Wexner.
Well, it's great to have you with us. And you, as chair of the Board of Governors, you have an amazing perspective representing a specialty, pediatric surgery, but also representing really general surgery, because pediatric surgeons tackle every problem that comes their way from top to bottom. And you've been in academics and are now, I understand, for the second time in a private practice setting. So you really do have your finger on all of the pulses going on. As such, perhaps you could start out telling us, what do you think are going to be your priorities this year for the governors to serve those fellows, academic, private practice, general surgeons, specialty surgeons?
Well, thanks for asking. It is unique to be a specialist who's also a generalist. And so we're always having to follow everything that every field does to figure out how to bring it into the pediatric world. And every now and then, pediatric surgeons come up with things that we like to introduce into the adult world. It's interesting to have the perspective of being in group practice, employed practice, private practice, academic practice all throughout my career. I can see where some of the pros and cons of each of those areas come in. And I hope to be able to use that perspective to help guide conversations. When I was a young member of the college, just a candidate member, I remember looking up to the Board of Governors and viewing them as my House of Representatives. These are the people where I have someone at my state chapter level or my local chapter level. I have representatives that come from my specialty area. So pediatric surgery has some. I do a lot of minimally invasive surgery, and my SAGES representatives are in there. So you have all of these representatives that come from all different aspects of how you practice, and they come together under the Board of Governors. And just as in advocacy, you can write your individual senator, you can call their office up, and you know they're going to hear your voice and bring that message forward to the person who has voting power or has the ability to bring it to someone who can create change. That's how I view our Board of Governors. And so my hope is that this year, everyone is willing to reach out to their governor and say, hey, here's what's going on in my practice. Is the college aware of this? How can we fix it? The college does so many things. It's like a Walmart. If you call the front office of corporate Walmart, they're going to try and get you to the right person. But you can be much more direct if you call your local Walmart and say, I need this department because I'm looking for this item. So my hope is that the message to all of the members of the college, candidate all the way through our retired members and international members, is if you have an area of your practice in surgery that you think people need to pay attention to or look at how to make it better or serve you better, contact your governor so that governor can bring that issue forward to the group of us who then can categorize it and make sure we find someone who can contact you and reach out to you and let you know we heard your voice.
That's great. That background is very helpful for everybody to understand. One of the other pieces you mentioned, the House of Representatives, we know that representatives are apportioned based upon population, and that with some changing of boundaries, representation sometimes changes. So an area with less representation has more representation and vice versa. How does a group get representation on the Board of Governors?
As part of our bylaws, the number of members of the college that you have in your group determines the number of representatives you have within the Board of Governors at the chapter level. And the similar will occur in the organizational level. And that's why one of the one of the jobs, one of the tasks that we ask each governor to do is to make sure you tell people what the college is doing and encourage people to join as members. Whether you're a medical student member looking for mentorship and information on getting into practice, whether you're a resident member trying to learn about fellowships and practice types and how to transition from a trainee to a practicing surgeon, whether you're a practicing surgeon looking for information to improve your clinical aspect or improve the hospital system around you, there's something there for you. And by joining the college, by showing that membership, number one, you increase your representation. Number two, you've got this channel. You've got that governor that's a voice. Most governors are selected from leaders who have served that organization or that chapter well. So they understand the milieu of the local state. They understand what's happening at each institution or practice in the state, and they can bring that voice forward. So again, I encourage you to use those leaders to increase your membership, which increases your voice and allows us as the college to serve you better.
It's great advice and great insights into the composition of the governors. One of the other facets you mentioned are the chapters. So yes, there are the societies. We both enjoy active participation in SAGES. You have your pediatric surgical groups, I have my colorectal surgical groups, but there are also chapters. So along the way, the college approves new chapters. The Board of Regents votes to accept new chapters recently, for example, in Paraguay, not terribly long ago in a couple of other countries. How are governors managed when a new chapter is created?
Well, there's actually a whole section of the college dedicated to supporting the chapters. So we have, for lack of better word, plug and play sets. We have proposed guidelines and bylaws for the institution. We have proposed leadership structures that allow representation for all of the different levels, our RAS members, our young fellow members, our women in surgery members, our underrepresented members. All of that is built into chapter bylaws and structures that are set up. The United States has been, and Canada have been so fortunate to have such wonderful infrastructure within the college. And we have all of these resources, and increasingly we are represented. We've recognized that this is a global community, and the onus is on us to share what we have already created so that smaller countries that don't have the resources and are never going to have an organization the size of the college can benefit from what we've grown and learned. And so we are enthusiastic about supporting the global world of surgery through these international chapters. Everything from our top 5 lists, our top 3 lists, where the top 3 new articles coming out of the in different specialties are going to be promoted, our guidance on how to create quality programs within your institution, how to get data back and use that data to improve patient care, how to advocate for change in a governmental system. All of those tools have tremendous benefit to others. So we are actively pursuing the growth of both international and domestic chapters. I think, I'm part of the North Carolina state, and we've been a fantastic state chapter. It's where when I joined the state and I didn't know the surgeons who were referring kids from around the state to me, I didn't know them, I could meet them. So, sitting down with a group from private practice that's 2 or 3 hours away and getting a personal relationship made me more likely to pick up the phone and call them about patients that they sent our way, or to make them comfortable sending to me. So there's a camaraderie that comes from those state chapters. In addition, each state has its own legislative priorities. We all have different governors and different legislative policies. We all have strengths and weaknesses, and learning how to use the state chapter for advocacy to make things better for our patients is a critical part of being part of that chapter. And so the ACS at a national level supports that through its chapter office.
Well, the governors does a lot on a daily basis, and people don't necessarily recognize that, but within the various pillars, and then the executive committee and the governors work with the chapters, it's a lot that goes on. But each year, a few things are focused upon, and the governors have produced many excellent statements about parental leave, for example, about wellness, diversity, equity, and inclusion. What are some of the goals on your radar for this year, if you have some sort of time-sensitive issues that you'd like to tackle?
Sure. Although I'm taking over as the chair this year, one of the things you should never do is stop momentum. So there are two projects that began under my predecessors that are really critical that they continue. And then one new that started, but I'd like to see grow a lot of momentum this year. So the first is, in fact, the diversity and wellness initiatives. We recognized we had problems with surgeon burnout or moral fatigue, or choose your term, but a lot of pressure on surgeons to perform in a high stakes world and not a lot of resources to support them when things weren't going as well as they wanted to, or they felt they couldn't accomplish personally and professionally what they needed. And so the college has put a lot of resources, and the governors have put a lot of effort into creating those wellness resources to help you give words and give a context and recognize you're not alone. And then how do I get through this as a team? That needs to continue. We're going into our third year of COVID, and disappointingly, it doesn't look like the end is nigh. People, the strongest people have maintained it for 2 years, but everybody fatigues at some point. So how do we continue supporting surgeons through these difficult challenges of shutting down elective cases, which cuts down revenue streams, and it also cuts down what gives us joy, operating and fixing patients. So how can we fill that void and get you through? And whether it's financial policies that we advocate at the government, or wellness resources, all of those play a role in wellness. The second is the diversity and inclusion. We have not done right by the underrepresented groups within surgery for a long time, and they've come a long way. But we have to give a voice to the additional challenges that they face each day. It's hard walking into an OR as a minority young woman and being told, oh, are you the medical student today? And it just crushes your soul when it happens day after day after day. And you just want somebody to recognize all the training that you've gone into and respect you for having the ability to operate on this patient. So how do we operationalize that? How do we change thoughts and biases and speak up for the people whose voices have been brought down? And that's where the people who've been in power for so long, we need you. We don't want you to say, this isn't my fight. I need you to be part of that fight. And how do we make that case to you to say, I need you to join us in moving the world of surgery further in the fields of diversity and equity? And the college is dedicated to this. We've hired a wonderful team at the college staff who are making sure this is a priority, and we build it right, and we do it fairly, and we do it in a way that we can make the whole world of surgery better. So the governors need to support that. The newest area that started last year that I think the college needs to really pay attention to is where technology and information and artificial intelligence are going. This to me is the laparoscopy of 20 years ago, where leaps and bounds change occurred in how we manage patients for appendectomies and cholecystectomies and common things. So there's great work being done in creating safety systems. How do we do augmented reality and improve our visualization laparoscopically? How do we then use AI to say, this is a dangerous spot for you to be, look out? How can we take our preoperative imaging and combine it in our intraoperative setting? And all of those things create new issues. So we watched EMRs come in and talked about how some people, it sucks your soul out of them to have to deal with an electronic medical record, but it's not going away. And it has made some improvements in patient care where you can get records from anywhere and you can get images pushed over. So we look at the positives, and then we have to look at how the negatives got in there and try and make sure, as we move into this next world of technology and surgery, and make sure that we do it safely, ethically, and in a way that makes the surgeon and patient experience better, trying to avoid some of the mistakes of implementation. So that's an area that I have a great team of governors in the telehealth and health information technology team looking at, that I really want to make sure stays ahead of it, because we want the surgeons controlling the message of how we bring these technologies into the operating room and our patient care in a safe manner, rather than being subject to what happens in non-surgical fields as they're introduced.
Well, that's a wealth of information, a lot of projects, as you say, some being continued and others being ignited, as it were. And you've certainly got a passion for all of it. That's clearly evident even during this interview. So I'm sure you're going to get all of it done. And I know the ACS, of course, has a tremendous commitment to the DI program, as do the governors. In fact, the governors are one of the cornerstones, with the pillar being initiated preceding, I believe, the Regental Committee. I'll give you the last few minutes in case you have any other messages you'd like to share with us.
We need to recognize that the House of Surgery needs to stand together, both in the various states, through all of our different politics, through all of our different specialties, and through all of our different practices. We are stronger as a group, advocating for our profession, for fair treatment in dealing with government bodies, and for our patients. And the more everyone comes together, the more people bring their voices to this organization, the more they say, we need this looked at, or you as a group need to change this, or how can we make this better, the stronger we're going to be. I just implore people to recognize that no organization is perfect, but we really have a great opportunity to build a powerful and meaningful professional organization under the college. We have new leadership this year. We're excited about Patricia Turner coming in. With that comes all kinds of opportunity. And I hope each member of the college takes a look at their practice and their local milieu and says, this is something I'd love to see improved, and brings it to us so that we can effect change.
Thank you very much for your time today. It's been most informative, and thank you for your leadership of the Board of Governors. I'm sorry I won't be in the Regents room anymore to benefit from your wisdom as chair of the Board of Governors. I know you're going to do a fantastic job this coming year. I look forward to watching your successes.
I appreciate the leadership you've provided. You were obviously our representative to the Board of Governors as I was coming through and serving as a pillar lead, and your example and insights were beneficial. So thanks for allowing me to climb onto your ladder.
All right. Stay well. Hope to see you in person one of these days.
All right. Happy New Year. Let's hope 2022 gets even better.